here we go. Nice. All right. Hello, everybody. Happy December. It is December 2020, the last month of the year, as far as we know.
It's December already. That's crazy.
Yeah. It's like this has been the longest year in my memory, but also it's getting close to the end. So how's everyone doing? Put in the chat. Tell us where you're dialing in from today. This is the Barton webinar, the Fixed Blood Sugar webinar with Dr. Saunders and Barton Publishing. I'm Joe Barton, and Leslie Prinz also is recording us and manning the chat and all sorts of stuff, making it happen. The one time she missed, I was in charge and I forgot to record it, so that was great. So yeah, good stuff. So good to see a bunch of new people hopping on today. We do this every Tuesday at noon Central Time, which is 10 a.m. Pacific, or 1 p.m. if you're on the right side of the country. And we don't need to go through every time zone in the world, but welcome. Glad you could join us. We're going to get to, today we're going to talk about blood pressure, high blood pressure, as well as type 2 diabetes and blood sugar. And this is in support of the Diabetes Solution Kit. So we talk about metabolic issues mainly, and we are here to help you on your journey. And so if you have questions, feel free to enter them in the Q&A section on Zoom or in the comments or the chat section as well. We'll get them there as well. If you're watching on Facebook, you can enter your questions in the comments there. Or you can send us a note via a pigeon carrier bird if you'd like. No guarantees that we'll get it in time, though. So that was a joke. Nobody laughed. Well,
I was
not
laughing.
that I would know.
It was funny.
All right. Yes, I'm wearing purple today. Kirk Cousins, my favorite quarterback on the Minnesota Vikings, had a great month of November. So I'm hoping he can carry it into December. And, if you're a football fan, let me know. I won't judge you. Okay, well, let's get to it here. Dr. Saunders, we are going to talk about high blood pressure. And let's start off with everybody's favorite part of the webinar, the disclaimer.
Okay, so we do not give specific advice for specific individuals. What we're doing here is providing a general framework, an idea, some knowledge and information, and how that applies to you might be different. So it's very important that as you listen to this, that you take this information to your healthcare provider and say, how does this apply to me? You can ask, how does this apply to me? Or does this apply to me? Or how can I apply this to me? And so if you apply it to yourself, make sure you do that with some knowledge of why it applies to you specifically.
Excellent. All right. Okay. Let's talk blood pressure. What are some of the common questions that you get from people about blood pressure, and how does blood pressure relate to diabetes and other metabolic issues?
Okay. Blood pressure is something that we have been told is so important that we have to monitor it all the time. And now you have home blood pressure monitoring, and people are calling me all the time and saying, my blood pressure was 142/88. Is that too high? And I tell them I think the stress of taking their blood pressure is worse for them than any blood pressure, elevated blood pressure could possibly be. So let's talk about blood pressure and what it is and how it came to be so important. So you have this this idea of the arteries in your blood the heart's pumping and the arteries are getting the blood through. And if anybody knows anything about fluid mechanics, the higher the pressure of the fluid, the better that fluid, blood in this case, can get to the end point being capillaries. Capillaries are so small, one red blood cell can't even fit through it completely. They have to like bend in order to fit into a capillary. That's how tiny capillaries are. So they're so tiny that you need sometimes a lot of pressure to get the blood through those capillaries. And even then, sometimes it doesn't work when people have their aggregated red blood cells and other issues in their blood clots and stuff like that. So the pressure of your blood is determined mostly by your brain. Your brain is saying, I need more blood. And that could mean I need more oxygen, I need more energy, I need more nutrients of some kind. So if there's anything missing from the brain says, hey, I don't have enough blood up here. Give me some more blood. I need some more nutrition. I need some more oxygen. I need some more sugar, or I don't have enough carbon dioxide, or I have too much carbon dioxide. So there's a lot of different reasons why the brain would be saying, hey, raise the blood pressure a little bit. I need some more. That is one of the reasons why the blood pressure can go up. But if you go online and look up symptoms of high blood pressure on something like wrongdiagnosis.com, where it just you list a whole bunch of symptoms and you try and find what your diagnosis is, there are over 300 different reasons why your blood pressure can go up. There's a lot. And knowing why your blood pressure is up is the only thing that's important in your life. If your blood pressure is up, you go, okay, my blood pressure's up. Now what? So if you're nervous and upset and you're in a dentist's office and you're like, oh, I hate the dentist. It just makes me so nervous. And then your blood pressure's up and the dentist goes, oh my gosh, I can't pull your tooth today. Your blood pressure's too high. It's like, duh. When are you going to go in and not have high blood pressure when the dentist is going to pull your tooth today, right? So those kinds of things, for some people that's a big issue, because that kind of thing will make any kind of nervousness, anxiety will make the blood pressure go up a lot, because it just constricts the blood vessels. And that's the why. So if you know why, it's like, okay. So if you go into the doctor's office and you say, I get white coat hypertension. When I go into a doctor's office, my blood pressure goes up. And so you check your blood pressure. Yep, it's up. You go home and check your blood pressure. No, it's normal. So do you have hypertension? No, you don't have hypertension. You know the reason why, right? So in any case, what you want to know is why. If your blood pressure is elevated because your adrenal glands are not functioning properly, then you fix the adrenal glands and the blood pressure goes to normal. If you have high blood pressure because you have clogs in your arteries to your brain, and your brain is saying, dude, we need some more blood up here, and makes the blood pressure go even higher so that you can get some blood into your brain, then you got to fix the arteries, or else you're going to have high blood pressure. So the association that you have high blood pressure with diseases like vascular disease and strokes and heart disease, those kinds of things, is an association, and it's an important association. If you look at strokes, for example, there's a graph. I don't have the graph with me, but if you look at the graph of the number of strokes versus the blood pressure, as the blood pressure goes up, the stroke level goes up, and it's like a pretty nice curve. It's almost straight. As more strokes, or higher blood pressure, more strokes, higher blood pressure, more strokes. And so that correlation is so good that all the doctors say, well, then blood pressure must cause strokes. But remember, association is not causation. So then they did a whole bunch of very large studies on people where they give them, half of them, blood pressure medication. And the ones that have controlled blood pressure with medication do not have a lower stroke risk than the people with high blood pressure, who are uncontrolled. In other words, if you have this nice correlation and you drop the blood pressure, the stroke risk stays high, even though your blood pressure is down to normal. That's because there's an association that's not causation. And it's associated with, like, vascular disease. So they were finding that people would go into the emergency department with a stroke, and they're having a stroke. The brain's not getting enough blood. So the brain is saying, dude, we need more blood. get some more pressure in here. So the heart's beating harder than ever, and all the blood vessels are constricted, and they're pushing the blood up to the brain as much as possible because the brain's saying, I'm not getting enough blood here. And so the blood pressure is super high. It's like 200 over 150. So you go into the emergency department and the doctor's like, oh my gosh, no wonder you're having a stroke. Your blood pressure's high. And they give you sublingual nifedipine and they drop that blood pressure down to normal and you die. And then they do it for another person and he dies. And they do it for another person and she dies. They do it for another person and they die. And they start scratching their heads after 10 years of killing people in the ER. They start saying, why is everybody dying when we get them sublingual nifedipine when they're having a stroke and their blood pressure is really high? Well, think about it, guys. Why is the blood pressure high? Because the brain's not getting enough blood. So what do? You drop the blood pressure, and what happens? Boom! You drop the bottom out of the what your brain needs to get some oxygen, and you just kill them. So they don't do that anymore.
Well, that's good.
That's not something they're going to do. Well, but it took a long time for them to figure that out. And it's really interesting that if you go into the ER with a high blood pressure, it takes about 30 years for the science to get into practice. And so, because you see these people who were trained, in the 1970s, 1980s, before this research was done, and they're still going, we got to get your blood pressure down, instead of saying, oh, question, why is the blood pressure high? Oh, that's why it's high. We need to fix that problem first. Isn't that interesting?
It is, yeah. Wow. Well, that's kind of discouraging that it takes 30 years to, for doctors to learn stuff like that.
Well, Joe, everything you've been printing is all stuff that's been available for 20, 30 years, and it's not yet part of medical practice. That's why we print what we print, because it's not generally known, and it's not part of what a doctor's going to tell you about when you go in for an evaluation.
So only 29 more years of coronavirus pandemic stuff. Great.
Yeah, hang in there with your mask, okay?
Oh man, yeah. Just let's do a quick little sidebar, because we are in the midst of, and this is a growing, concern. There are more cases coming, or being made public. But give us a quick update on coronavirus and what can people do to stay healthy.
Okay. The coronavirus is a normal pandemic that happens fairly often. Every year we have a pandemic. We call it the flu. The CDC, the Centers for Disease Control, doesn't keep track of every case of the flu, so they just call it ILI, influenza-like illness. And that includes everybody who goes to the hospital because they're sick with flu-like symptoms. So, and that includes coronavirus every year. It includes the respiratory syncytial virus and orthomyxovirus and paramyxovirus and all of the rhinoviruses. So all of those that cause flu symptoms that cause people to get sick and go to the hospital, we call that ILI, influenza-like illness. And so that's how it's tracked every year. And every year we have a flu season, and every year in the Southern Hemisphere, they have an opposite flu season. And we have the flu season in the Northern Hemisphere during our winter, and the Southern Hemisphere, they have it during their winter. It's kind of interesting. If you just track vitamin D levels, the flu season follows vitamin D levels very nicely. In other words, people still get sick all year long. People are still getting viruses all the time. They just don't end up in the hospital. They don't get really sick and go to the hospital with it when they get enough vitamin D. And that would be during the summertime when they're exposing their skin to a little more sun. And then wintertime when they're indoors the whole time, or it's overcast all day and they're not getting any sunshine, then their vitamin D levels drop down and they still get the virus, but they just don't get sick and they don't go to the hospital. And the same thing happens in the Southern Hemisphere. During their summer, they're getting more sun, and then their flu levels drop down. And so you have this cycle that happens. It's called they don't call it a pandemic, but it is. Every year it's the same thing. And it's different viruses all the time. And sometimes it's more than one. It might be 2 or 3 different viruses that cause it. But it's not like this virus travels around the world and only comes to see us during the winter time, and only comes to the Southern Hemisphere during their winter time. It doesn't travel around the world. That's not the way the system works. The system is, we're getting it all the time. We're spreading it. We're seeing other people and having contact with other people, and we don't wash our hands. That's probably the most important thing. Masks don't help, by the way. They never have. Multiple studies have been done on these flu viruses, and masks have never helped. Probably from the best research, probably a mask has never prevented a single influenza infection or coronavirus or any of those ILI illnesses. Yes. So what do we have here? Well, we have a pandemic. It's the normal pandemic that always happens every year. And so if you look at the current CDC statistics, we're at our very lowest, which every year that's where we are. We're at the lowest rate. And it's just starting to kind of go up. And then the media jumps on it, and they go, oh my gosh, we had more cases yesterday than we did the day before. We better shut everything down. And it's a lot of fear mongering, but it's not real. It's, you guys don't freak out and don't get so upset. And it's the flu. It happens, and it happens every year. You know what? Every year, 100 million people plus die from the flu. This is not an unusual thing that you can have, 60, 100 million people die from it. Some years it's only 30 million. It's just different, a little different every year. If you look at the CDC statistics, it's very interesting.
So people with compromised immune systems are vulnerable, whether it's coronavirus or influenza or all sorts of other things, right? And so vitamin D seems to be like probably one of the best things you can do to improve your immune system, in addition to other things like getting good night's sleep and different things.
Yeah, the best correlation they found is not sleep, and it's not nutrition, it's not vitamin C. Vitamin D is actually the best correlation. If you have good vitamin D levels, you'll still get the virus and you'll still test positive. But you won't get really sick, and you won't end up in the hospital, and you won't end up in an ICU, and you won't end up intubated. Or almost, it'll be really rare that happens if you have good vitamin D levels. People can still die of the flu during the summertime when there's, more sunshine and more vitamin D around. It's not that it never happens. It is that there's a sort of a baseline level. And during the winter time, because fewer people are getting vitamin D every day, the level it goes above the baseline level, like double or triple the baseline level, and then it goes back to baseline again. So there is a baseline level of all year long of people dying from influenza, but it's and so it's not all vitamin D, but you know what? That is a big factor of all the other things that have been looked at. That is probably the biggest.
Well, and I think, cases have gone up a lot, and South Dakota is a great picture of that, because our cases have gone up a lot. But I think the reason, is because more people are getting sick from it. There probably have been just as many cases throughout, but now they're getting sick from it because their vitamin D levels are lower. Nobody's out in the sun right now. And if you do go in the sun, like in the summertime, you're getting like 15,000 to 30,000 IUs in like 10 minutes in the sun, which is a huge amount, which is way more. Like I think the RDA recommended daily allowance is like 600 IUs.
400,
400 to 600. Yeah, it's way too low. And so, there's more publicity about vitamin D in some places you'll look in the media or whatever, but they're still not telling you to take nearly enough. So tell us, before we transition back to high blood pressure and and diabetes. How much vitamin D should people be taking this time of year?
I think during the winter, the best amount of vitamin D to take is about 5,000 a day. I've tested hundreds, probably thousands, yes, definitely thousands of people. And I find that you need around 5,000 a day to get up to a good level that will prevent disease. And it prevents cancer too. You know, this vitamin D is an immune system activator of the cellular immunity, which is very important for a lot of different things, not just viruses. Viruses is just one part. Fungi and cancers are also inhibited or taken out by the immune system, by the cellular immune system, which is activated by vitamin D. Mm-hmm. So 5,000 a day, up to 10,000 a day is usually pretty good. Most of the people that I have, if they want to do a weekly, if they don't like taking pills every day, then I put them on the 50,000 once a week, which is the standard prescription dose. That's what, you know, if you ask a doctor for a prescription, that's what they'll give you, 50,000 units once a week.
Yeah. And if you're like a younger child or something, or your body weight, let's say you're 50 pounds, like, do you take a third as much or half as much, or does it matter?
That's really interesting. It doesn't matter because it's a fat-soluble vitamin that is stored in the liver and used as needed, and and the amount in let me give you an example. 40,000 units of vitamin D is 1 milligram. So even the 5,000 milligrams is just 1/8 of a milligram. It's really small amounts that you're getting, yeah. And children should get right around 5,000 units as well.
Okay, so if you're watching this and you're taking CinnaChroma, good news. CinnaChroma has 5,000 units in every capsule, as well as vitamin K2, and K2 has something to do with the calcium as well, or something like that, from preventing too much calcification. Is that right?
Yeah. So if you just take calcium and vitamin D, then you get this extra calcium in your blood, and it can deposit in your arteries. And they've actually shown women taking calcium over a long period of time getting hardening of the arteries. So in order to prevent that, you want that calcium to be stored in your bones. And the way to do that, number one, get enough magnesium. We talked about that last time. And then number two is to get vitamin K2. So there are several different kinds of vitamin K. And in my research, it doesn't matter that much, but the K2 is the more active form. So that's why we put that in there.
Yeah. So any products that you want, you can get 25% off by using the coupon code webinar25 because you're a webinar watcher. So thank you. You can go to bartonwebinar.com or bartonnutrition.com, and you can find links to our products. Okay. All right, let's transition back to high blood pressure and diabetes. So I just thought it'd be good to get a quick little coronavirus update there. So, but let's talk more about blood pressure. What are some other
okay.
Yeah.
So the next thing with blood pressure is, how does it relate to diabetes, and why do we have this thing called metabolic syndrome? Metabolic syndrome is abdominal obesity, high cholesterol, high blood pressure, and high blood sugar or insulin resistance. So that combination of factors is called metabolic syndrome. And because they tend to come together, and people that have this kind of sugar metabolism tend to have more of the central obesity and the high blood pressure. So the blood pressure will go up, remember, for a lot of different reasons. We were talking about the brain reasons and strokes a few minutes ago. But there's the adrenal hormone reasons. If you have a lot of stress and you're putting on a lot of adrenaline, epinephrine, and norepinephrine, your blood pressure will tend to go up as well because it causes constriction of blood vessels. There are a lot of other reasons of inflammation. So it seems that with this metabolic syndrome, there's more inflammation that causes constriction of blood vessels. Part of it is that the blood vessels themselves are getting damaged. And whenever you have damage, you have inflammation. Always. If you hit, which I've been known to do on occasion, pounding a nail and I hit my thumb and it gets hot and red and really tender and swollen. What is that? Inflammation. Inflammation causes the swelling, but it also causes constriction of other blood vessels around it. So when people have diabetes, they tend to have higher levels of these inflammatory mediators that cause constriction of blood vessels. So the blood pressure goes up, but does the blood pressure cause a problem? That's where the question comes in. And the answer is no. Blood pressure is not the issue. The issue is the metabolic syndrome. It's the damage to the blood vessels. If you don't fix the damage of the blood vessels, I don't care if you bring the blood pressure down. You're not going to get better circulation. You're not going to get your neuropathy is not going to go away unless you improve the circulation. So you have to improve the circulation and not worry about the blood pressure. The only reason we have so much concern about blood pressure is because there's a drug for it. And for over 50 years now, people have been told that blood pressure is the silent killer, that it's going to kill you, that you have to take your blood pressure medication every day or else you're going to die. And what happens if I don't take my blood pressure? Well, you're also going to die. What happens if I do take it? Well, you're still going to die. Either way, you're going to die. So they're not lying to you, but they're just not giving the big picture, the whole thing. Every time you have high blood pressure, you just need to know one thing: why.
So people with diabetes are more susceptible to like diabetic neuropathy because of poor circulation, right? And so if they have high blood pressure and then they're taking a blood pressure medication to lower their blood pressure, wouldn't that make their circulation worse to their extremities and the neuropathy worse? And then they probably get a drug for that, right?
Exactly. And you know what, Joe? You thought of that just logically. I mean, you just logically thought of that. You didn't have any medical training. You didn't go to medical school to figure that out. And I don't think I ever told you that. So if you think about it logically, and that's really exactly what happens. Just like with the brain, when you're having a stroke and you need more pressure and they suddenly drop the blood pressure and people die of a stroke because they weren't getting any blood to their brain, and it was the drug that killed them. In the same sense, when your blood vessels aren't working very well and you drop the blood pressure, you're going to get less blood flow. And if you get less blood flow, then you have less oxygen to your nerves, and you get more diabetic neuropathy, more infections, more osteomyelitis, and more amputations. So, and that has been shown in several different studies. The largest study was the UKPDS study, the United Kingdom Prospective Diabetes Study. And this compared two groups of people. One group of people had were controlling their sugar and blood pressure with medications, and the other group of people were not. And the ones that were not controlled with medications had higher blood sugar, higher blood pressure, and 12% less amputations, blindness, and kidney dialysis. 12% less, and they had higher numbers. So when they published the study, they didn't tell you about that. All they told us about, the doctors only know that in the UKPDS study, if they were on medications, their numbers were better. Wow. That's all. The blood sugar was better, the blood pressure was better. That's all they told you. They didn't tell you that they had more complications, even though they had lower numbers.
Higher mortality? Possibly? Higher mortality.
Wow. So Joe, you were right. You know, you figured that out. And all these doctors around the world are not thinking logically. They're just taking in whatever the drug companies tell them and spitting that back to their patients.
So Joyce has a great question that segues perfectly. How do we improve circulation?
Very good question. Okay. Circulation is improved by a lot of different things. Number one, get your blood sugar normal. Get your insulin resistance down so you have normal metabolic hormones. Once your metabolic hormones are normal, then your blood vessels can respond appropriately to the medications. That's number one. So phase one of the diabetes solution kit will tell you exactly how to do that. So that's number one. Number two, there are a couple of supplements that you can take. One is called Alpha-lipoic acid, and the other one is called Benfotiamine. We put these two together in a supplement that has the amounts that were used in the studies that showed benefit. So what the Benfotiamine does, if you've ever heard of thiamine, that's vitamin B1. So thiamine helps to repair the lining of the blood vessels, all the damage that I was telling you about that caused this high blood pressure, the inflammation, that is repaired by thiamine. But the problem is thiamine is water soluble and doesn't get into the cells very well. So this benfotiamine is a fat soluble thiamine, and that gets into the cells that line the blood vessels, and it repairs the lining of the blood vessels and allows normal circulation. That's how that works. The other one, alpha-lipoic acid, works in a totally different way by increasing the energy supply, improving the mitochondrial function, which is how the energy is made. So for improving circulation, number one, fix your blood sugar. Number two, take the benfotiamine is another one. Exercise.
Real quick, seems like you mentioned that. That's all in Nervala, the alpha-lipoic acid and benfotiamine. You can also get that from us. But so is alpha-lipoic acid, is that fat soluble as well? Is that a fatty acid? Yeah.
Yes, that is a fatty acid. It's actually both water soluble and fat soluble. It's kind of like an emulsifier. So yeah, that gets into the cells really well, gets into the mitochondria and helps decrease the inflammation and the oxygen-free radicals in the mitochondria. Okay. So number three, exercise. Exercise is very important for circulation, and as we exercise, we make hormones that dilate the blood vessels to allow more flow through, like the legs if you're walking. And the best way to do that is to start off as much exercise as you can. So if you can only walk a block, fine, walk one block. You don't have to kill yourself. You don't have to run a marathon the first day, okay? Just take a short walk and then go home. And then if you feel a little better, you can do it later, then do that 2 or 3 times a day and just increase incrementally by a small amount, just like 2 steps a day, a little farther, 2 steps further, 2 steps further. Each day you're just increasing by 2 steps. The next thing you know, you get to about 3 miles. If you can walk 3 miles, you will stay out of a nursing home and you will not have to have amputations of your feet. That exercise is so important that I recommend everybody at least walk. If you can run or jog, that would be great too. If you prefer riding a bike, that's fine too. If you don't mind sitting around in a gym on a treadmill or on a spinning machine, whatever kind of spinning machine or stair stepper, just make sure you take the escalator up to the top floor where the stair machines are, so you can do the stair machines. No, I'm kidding. Don't take the escalator. Take the stairs.
I've got a question kind of related to exercise, but all right, this is like Hypervolt is the name brand, but it's one of those massage guns. And what do you think of these? Do you recommend them? They really get the blood circulation going in different places. Like if you got, kinks or whatever, just get this thing going. Bah, 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 I love it. But what do you think?
Yes. Okay. Massage. That was going to be on my number 5 or 4 or 5 or something. Yeah.
Okay.
Massage works. Massage improves blood flow. And if done properly, it can be very useful and improve circulation. Acupuncture, one of the things that acupuncture does, of course, if you ask the acupuncturist, it's going to be to balance your chi. But I don't know what chi is, so I have to look at it just from my physiology of what I learned in medical school. And one thing it does do is improve blood flow. So acupuncture will increase the blood flow to certain areas and then allow a healing of the nerves and various and everything that needs to be healed as well. So acupuncture, massage, heat. So heat is very useful also. And if you want to have really good circulation, there's something that's really unusual. And that is, if you've ever heard of Wim Hof, he has a program for breathing techniques. And it's kind of a strange thing because I just told you heat will dilate the blood vessels and allow better circulation. Well, he does it by just the opposite, and that is freezing cold temperatures. So taking freezing cold showers or jumping in ice baths or something like that, along with a breathing technique. And this is not, he didn't develop, well, he kind of developed it on his own, but it's been known for many, many years, hundreds, if not thousands of years. The yogis in the Himalayas have been known to be able to sit with nothing but a linen smock on in way high up in the Himalayas in the snow, and they just breathe and they take in breaths, and the snow will melt around them, and they will be warm. And that is all about circulation. So if you learn the Wim Hof breathing technique along with the taking the cold showers or whatever, the cold water baths, that improves your autonomic nervous system and allows your autonomic nervous system to manage your temperature better and your circulation better.
Yeah, if you want a shortcut on the cold showers, like you don't have to walk into a freezing cold shower to start. Like take a normal shower, and then at the end of it, just crank it to maybe halfway. And my shower, it takes like 5 to 10 seconds. I crank it, it's like, okay, it's gonna change. And then it's like 2 seconds of like, it's cold, but then like your body adapts really quickly. It's kind of fun. And so like you can just, ratchet it down a little bit each time. And eventually you'll be able to take cold showers. And so, I don't know, going cold turkey to me, that would be like, yeah, no, thanks. But
no, I do that. After the breathing, I don't heat my swimming pool, and it's pretty darn cold in the winter. Well, it's 50 degrees ish. I'm in California.
That's
so
cold.
Yeah. So I just go jump in my swimming pool and all the way.
Yeah, because I think groundwater temperature is 55 degrees from what I remember, and that's plenty cold.
Yeah.
If you go to our YouTube channel, episode number 24, we talk about this cold therapy. So we go into, Dr. Saunders goes into a lot of detail on that. So be sure to check that out. Actually, I'll post the link in the chat.
All right.
So that's a good way of improving your circulation. All of those things will improve your circulation. It's not just one thing. You want your autonomic nervous system to work. You want your blood vessels to work. You may need acupuncture or something to balance your chi so that you have good blood flow. And massage and the supplements and getting your blood sugar under control. That's really important.
So if you want this massage gun, just go to Amazon, type in massage gun, and you can find them for like $90 or less. And I'm telling you what, like this, I brought this on one of our company retreats recently, and this thing like was used all the time, and people were like,
it was a hit.
This.
It was a hit. Everybody used it.
It was. Yeah, I highly recommend it. They have like smaller versions that are like $49 or $39, I think. And so we don't sell them, but I recommend them. And so like, I love what you're talking about because it's holistic health. It's a lot of different things you can do that just each one improves your health. And it kind of helps you get out of the traditional medical way of doing things, which is medicate, put Band-Aids on symptoms and things like that. Instead of what we're teaching is functional medicine, getting to the root cause and the root source, and then, figuring that out and, going straight at it. And then, you can have much better results. You don't have side effects from all these medications and different things. So that's really probably the biggest reason we exist, is to help people get off of medications and experience real, true health. So let's get to questions, because we've had, so this is awesome. I think we hit our limit. For Zoom participants, the highest we've ever had on our webinar. So awesome. Great job, everyone. Thanks for joining us. Let's get to some questions here. Leslie, I'll turn it over to you.
Okay. Lots of people saying hello. We did have someone say go Steelers earlier in the webinar. I didn't know if you'd appreciate that.
Teresa, yeah, well, it's easy to be a Steelers fan when they're undefeated, but anyways, I'm not bitter.
Okay. Let's see. Wayne is asking, what is the relationship between blood pressure and kidney function?
Okay, thank you, Wayne. Remember I said there are over 300 different diseases associated with high blood pressure. There are several different problems with the kidneys that can raise blood pressure. So some people have something simple like renal artery stenosis, which means the artery that goes into the kidney is narrowed for some reason. And so the kidney is getting a very low flow and going, gosh, we need some more pressure. So the kidney raises the blood pressure. So the brain can raise the blood pressure, like I said before. The kidney can also raise the blood pressure. And a lot of different kidney problems cause elevated blood pressure. So it's not just the brain, the kidneys, the heart, even the lungs affect your blood pressure, how you're breathing. There's a really good book I read recently called Breath. And so if you want to read that book, it's really interesting, and you can actually lower your blood pressure. He explains about that too. So how you breathe. So yes, the kidneys definitely can affect your blood pressure. If you have kidney disease from diabetes, for example, you can get higher blood pressure just because your kidneys are less functional from the diabetes. So yeah, it's not just one thing. There's a whole bunch of reasons why that could happen.
Okay. We have a question from Susan. Good afternoon. What is Dr. Saunders' opinion about Islet or Islet cell transplants?
Islet cell transplants. Okay. I don't have much of an opinion because I haven't seen any long-term studies. I don't know if there are any because this is kind of a new thing. So an islet cell is in the pancreas, and they can take the islet cells out of a pancreas and put it into somebody else to have that the islet cell start functioning in people whose pancreas doesn't make insulin. So if you don't make insulin and you want your pancreas to start making insulin, then they can transplant islet cells into you and allow those islet cells to start making insulin and glucagon, by the way. And I don't know how well it works, and I don't know of any long-term studies, but it can be done. And I think it's mostly experimental at this point.
Okay, I'm reading through all these comments here. Okay, Krish said, how to differentiate problems of inadequate blood supply to the brain as against problems of vestibular or sinus systems.
Okay, I think what Chris is talking about, people get symptoms like dizziness. So if you stand up and you go, whoa, and you get really dizzy, lightheaded, that means you're not getting enough blood to your brain. And that can happen for various reasons. Let's say you're just hot and your blood vessels are dilated. And so you stand up and the blood runs out of your head and goes down into your legs and your body and everything. And then it's going to take a couple of seconds for those blood vessels to constrict down, to push the blood back up to your head. And then you go, okay, I'm good. I can go on my own. But some people have vestibular problems, which means the inner ear has the vestibular system that helps to tell us where we are in space. And if that's not working, you get something called vertigo. Vertigo is different than lightheadedness. Vertigo is, I'm sitting here minding my own business and I just turned to look and the room started spinning around. And, it's a dizziness of the room spinning around like you just got off a merry-go-round, not like you just stood up and felt lightheaded. So those are two different things that happen. One is the vestibular, and then the other is lightheaded. A blood vessel problem, and it could be blood volume. You might be just dehydrated. Dehydration causes you, when you stand up, to get lightheaded too. So looking at the reason why, Chris, the answer to that is knowing what the problem is. So if your circulation is not getting up to your brain, it's not usually an occasional problem or an instantaneous problem. It's usually more of a long-term issue. And that could cause either lightheadedness and or vertigo as well. So,
okay. Someone is asking, which of the products, CinnaChroma or Nervala or both, would lower blood pressure? And if they do, how much should you take per day?
Okay. The purpose of those two is not to lower blood pressure. The purpose for those two medications, one is to improve the way your insulin works in your body. So CinnaChroma is about how your insulin functions, so that you can improve insulin function, so that you can lower insulin resistance, so that you can get rid of your diabetes. So that's a helper for you to lower the sugar primarily. The Nervala, is to repair primarily the nerves. It's really for people that have neuropathy or have a potential for neuropathy. And their purpose is not to lower blood pressure. Remember, you don't need to look at something that's going to lower your blood pressure. What you want to know is why you have high blood pressure. And if it's diabetes, then you have to first control your blood sugar. That would be the number one thing to do. And then all of the other things that we talked about before.
Okay, another question here about CinnaChroma. Let's see. Is CinnaChroma a must in order to treat type 2 and lower blood sugar? What is the breakdown of the ingredients, as we have to buy this in Canada?
Oh, okay. So there's nothing miraculous about CinnaChroma. It's just a group of things that when meaning me and others at Barton Publishing, we sat down and we said, what's missing in all the supplements for diabetes? What is it that people aren't getting that's going to work and going to help? And so we looked at the common things that I see personally and that are common in society, and that is vitamin D deficiency, very common. Not enough vitamin D prevents the insulin from working properly and can increase the diabetes. So vitamin D, 5,000. You're asking the ingredients, so I'm going to give you them as we go. Chromium. You can get diabetes just from not having enough chromium. Chromium is really important for blood sugar control. And so that's 200 micrograms. Selenium. Selenium is also very important for diabetes, especially for prevention of nerve problems. Selenium is necessary for making something called glutathione in your body that improves the function of mitochondria or helps prevent damage to mitochondria. Vanadium is also a trace mineral that is very important for using the blood sugar properly, and that's 50 micrograms. The other one, the selenium, is 200 micrograms. And then vitamin K is 200 micrograms, something like that.
Yep.
Yeah, what is it, Joe?
300 micrograms of vitamin.
300 yeah. So 300 micrograms of vitamin K is so that you can use the calcium that you're absorbing from the vitamin D. Really is mostly the reason for that. That's not specific for diabetes. So there's nothing magical about it. It's just these are common deficiencies and common reasons why people would have more insulin resistance than other people, even if they eat the same. If you're deficient in those things, you're going to have worse insulin resistance than people who aren't deficient, and even if the diets are the same.
There's so many questions. Oh, I wish we could get to all of these, you guys. We'll have to try to address some of these later. Also, we should let you know about our YouTube channel because we have 67 webinars recorded for you. You can search topics, basically anything you may want to learn about concerning type 2. You will find it there. So you can go to, I posted a link, but you can get there from bartonwebinar.com. You can also subscribe to our channel there. So make sure you do that. We'll probably be able to get a lot of your questions answered there. So let's do a few more, maybe specific questions here. Joe, see any that you want to throw out there?
The pulsatile tinnitus or tinnitus was a good one. Are there any natural remedies for? I have not heard of that pulsatile. It's rhythmic with the heartbeat, it sounds like.
Yes, and that's what happens. In other words, you can hear in your ear, you can hear whoosh, sometimes a whooshing or hissing sound that's pulsatile with the heart rate. That is often a problem or it indicates that there may be a decrease in blood flow or some kind of kink in the carotid arteries or the vertebral artery. And so before I would do anything as far as like a natural remedy for that, I would find out if you have a stenosis of the carotid or vertebral arteries, and that's simply done with an ultrasound. So tell your doctor you have the pulsatile tinnitus, and she or he will probably recommend that you have an ultrasound of your arteries in your neck to make sure that that's not the issue, because that's not the only reason, but it's one of the more common ones, especially if you have diabetes.
Okay. All right. Somebody asked about, let's see, so this is a good question. How do you know if you are producing insulin?
Well, I test. I test everyone. Because if you don't test, you can't be too sure. The test tells you, I prefer a test called the C-peptide. C-peptide is a little more long acting. It's the waste product from the insulin. So insulin is made and it's this really long protein, and then it's cut up into this really short, just the active insulin is pretty short, and all those waste parts that are taken away are, we call it, or one side on the C side is a C-peptide, and you can measure that, and that's it kind of hangs around a little longer than insulin, so it's not so instantaneous, and it can give you an idea of how well your pancreas is functioning. But I find insulin levels on a fasting specimen very useful as well. If it's around 5 or less than 10, it's generally okay. Over 10 is a little high, but I've had people in the 30s and 60s and hundreds on a fasting specimen, which means they're super insulin resistant.
Okay. Somebody asked about what is the diabetes detox program, and so that's basically that is the same thing as the diabetes reversal program, the diabetes solution kit. It's just another name we give it, but we also include the videos. There's like a 6-part video series that Dr. Saunders did.
Yeah, the reason I call it the diabetes detox program, because I want it to be clear to everyone that you're toxic on sugar. That's what sugar diabetes is. It's just a sugar toxicity. It's that simple. And if you're thinking, oh, I'm going to detox, that means I'm not going to eat sugar, which includes starches and all that stuff. So that's why I thought it was a good way to look at it.
Yeah, and the basics of the phase 1 program is really to reduce your carbohydrate intake to 20 grams of carbs per day or less. And also, you're a big advocate of not eating anything sweet, even if it's like monk fruit or stevia or anything like that, because the sweetness is what triggers your pancreas to release insulin, and insulin is really a bigger problem if you have too much insulin going on. So by reducing your intake of carbs to 20 grams and reducing your taste of sweet, that's really going to like double down your results quickly, right?
Yep.
Yeah. So that's kind of the nuts and bolts of this. And so, you know, if you get a copy of the Diabetes Solution Kit, we have recipes in here. We have the grocery list. We have a lot of other tips and different things in here. And so get a copy of this. It's available on bartonwebinar.com at the bottom of the page. Or you can go to bartonpublishing.com. We have all sorts of different places. But bartonwebinar.com is the easiest place to go if you're watching this. So somebody must have joined us a little late. They asked how much vitamin D3 should be taken daily, and you've said 5,000 IUs a day, which is, how many micrograms is that? Do you remember? Is it?
It's 0.125 milligrams.
Yeah. Okay, so 125 micrograms. Yeah. 125
micrograms.
Yeah, or 50,000 IUs per week as well. And I've heard that if you take it like monthly, it's not nearly as effective. It has to be weekly or more frequently, right?
And you know what? That's true. And there have been several studies that have shown that. And so that goes towards like the sunshine, getting sunshine once or twice a week, or laying out in the sun once a month may not be enough. You might actually need a little more daily sunshine to get your vitamin D and all that.
Yeah, you can't just go lay on the beach for 12 hours and think you got your year's worth of vitamin D. It doesn't quite work that way.
Nope.
You look like a lobster.
Well, you would.
I would. Somebody did ask, where's your suntan, Dr. Saunders? You're in a tropical vacation last week. They were expecting you to come out like probably more golden tan, like what's his name on that? What's the name of that? David Hasselhoff.
Oh yeah, David Hasselhoff. Malibu, whatever that was. Yeah.
I forget the name of it. It's
yeah. Well, I went for walks on the beach, but I pretty much kept my hat on. I didn't wear sunscreen so I could get some sunshine, but I was careful not to get burned.
Good. Well, did you have a good time with your family?
Oh, it was great. It was great.
How many of your family members were there?
We had 15 there.
Wow, that's awesome.
15. Yeah.
Probably don't get to do that all that often anymore, huh?
No, not very often. This is once in 5 years we all get together.
Yeah, awesome. Okay, well, hey, I think we're going to wrap things up here. We like to try to keep our calls at about an hour, so we are right about there. And so, yeah, thanks for joining us, everybody. If you want to learn more, go to bartonwebinar.com. Go to our YouTube channel. From there, you can watch all sorts of previous recordings. We'd love to have you join us next week if you're watching this later, and you can register right on that bartonwebinar.com link as well. And we have a Facebook page as well if you want to join us there. It's called the 610 Reset. And real quick, the 610 Reset is basically our clever way of saying stop eating food at 6 o'clock so that you can have an empty stomach by 10 o'clock and go to sleep, and then your body basically resets itself and maximizes the human growth hormone HGH production. And we talk about that more on the Facebook page as well as in previous webinar recordings. So, all right, Dr. Saunders, close us out here. Give us a final note.
Okay, so one of the things I really wanted to say about hypertension is I'm speaking very, very narrowly with hypertension to a group of people who potentially have diabetic issues, right? Metabolic syndrome, diabetes. And so that's the advice that I'm giving. Remember, the number one important thing is find out why your blood pressure is high. If it's not diabetes, if you have an adrenal gland problem or a brain problem or a kidney problem, you need to know that too. So finding out why you have high blood pressure is much more important than treating it, because high blood pressure doesn't cause the problems. It's whatever the underlying disease is that's making your blood pressure go up. That's what's causing your problems.
Yeah, that's good. That's actually something I was going to ask you about that I think I'm going to ask here quick because it's important. So what are the top ways to figure out what's wrong? Like blood tests,
Yes. Yeah, there's standard blood tests that you do that just look at kidney function, liver function, whether you have anemia or not, heart function, do you have any congestive heart failure or anything like that, lung function. But you just start whittling away at things and you do tests, you go, oh, all those tests are normal. And then you do an ultrasound, you maybe look at your arteries. I've had people do screening tests, the ultrasound screening, that they come around in a truck and park in a parking lot, and people do screenings and they look at the arteries, and they come to me and go, oh my gosh, look at my arteries are all blocked. Oh, there's your issue right there. And so just keep looking for why, and do blood tests for all the hormones, and look at what's your adrenal function look like? What does your thyroid function look like? What about your sex hormones? And all of those will have an effect on your blood pressure, but they may not be the cause, but they might lead you into, oh, looks like there's an adrenal issue. Let's look into that. Oh, look, you have a tumor that we wouldn't have picked up if we hadn't have found that cortisol a little elevated, kind of thing. So just continuously looking, because remember, there's not like 4 or 5 causes. We're talking 300 different reasons why your blood pressure could be elevated.
Right. And I think too, like, God created us amazing. Our bodies are amazing. Like, our bodies talk to us and tell us what's, if something's wrong, like whether you're not sleeping well, or you have aches or pains, or whatever, low energy. There's all sorts of things that just, like, take note of those things, and then talk to your doctor and share all those things, and then they can help you discover, like, okay, this is probably going on here if you got all these things. Because, like, I go to a chiropractor and probably once a month, and they're always asking me, like, all right, what's going on? And I have a hard time remembering at that moment when I'm standing at the office, like, okay, what's all things. But if you keep track of it, like, throughout the month or whatever, like, you have a better, like, a holistic, like, all right, all these different things are going on, and then they can attack different things and look for different things. So I don't know. I just thought I'd plug that our bodies will tell us these things as well. So another part of looking, searching, seeking you shall find, right?
That's good parting words right there.
Yes. All right. With that, we're heading out. Thanks, everybody. Thanks for joining us. God bless. We'll see you next time. Have a great week.